Great. Looks like we have the attendees coming in. So, well, welcome. My name is Dr. Robyn Watson Ellerbe, and I am the Distinguished Senior Fellow at the Institute for Women's Policy Research. I am also an author and contributor of two new analyses IWPR released this week, entitled Flexible Work and Women's Wellbeing, a poll we conducted in collaboration with Morning Consult, and the intersection of workplace flexibility and exercise by gender, race, and ethnicity, a report examining the impact of workplace flexibility on women's health and well-being and their ability to maintain an active, healthy lifestyle. Here at IWPR, we released these findings this week, which is the same week as the 5th anniversary of President Trump's COVID-19 emergency declaration, which, as many of you know, triggered a massive explosion of remote work, which is also in contrast with the president's current rescission of remote work options for all federal workers. So during today's webinar, my fellow authors will discuss our new analysis and its key findings. Following, I will moderate a panel of colleagues from GirlTrex, let me get that straight, the American Association of People with Disabilities, and the University of California College of Law, San Francisco, on how, for women, and especially women of color, workplace flexibility is a gateway to achieving better health and well-being. But before we get started, I have a few housekeeping items, of course. So the first thing is, if you have any questions, feel free to submit them using the Q&A feature. And time permitting, we will address as many as possible during the Q&A portion, which will be at the end of the panel portion. And then also we want to point out that the Zoom's automated closed caption is available if you choose to use it. You can enable captions from the toolbar. And then, as many of you guys heard when you approached, the webinar is being recorded and will be available for viewing after the session. So please watch for it on IWPR's YouTube channel, and please share it with individuals you know just weren't able to be here today. So again, thank you for attending, and we hope you enjoy this session. So to start off this session, I want to introduce my fellow authors of IWPR's new report. Ariane Hegevish is a senior research fellow at IWPR. She has published many papers and articles and co-edited several books, including Women, Work, and Inequality: The Challenge of Equal Pay in a Deregulated Labor Market. She has a bachelor's in economics from the London School of Economics and a master's in development studies from the Institute of Development Studies, Sussex. And then we also have Dr. Bindaria Bambasoren. She's an applied microeconomics and a former IWPR postdoc fellow. Her research areas include care work, aging, gender norms, and inequality. She is currently working on distributional impacts of climate change at the World Bank Climate Economics Unit. Bindaria has a PhD in economics from American University and a bachelor's in economics from Mount Holyoke College. So Ariane, I pass it on to you. Ariane, you are muted.
Thank you for that introduction, Robyn. And we would also like to thank the Robert Wood Johnson Foundation's Policy for Action program, which helps us conduct this research. Before I hand over to Bindaria, let me briefly say where our research fits into the general kind of landscape of research. We are talking today about the positive links between employee-centered flexible work and health for women, including women of color. And we're going to look at pre-COVID analysis from the 2018 American Time Use Survey, which will help us look at access to flexible work options and their link to exercising. And then, as Robyn said, a survey we commissioned from Morning Consult on flexible work and women's health and well-being from November of last year. And how this fits with general research in this area is there is good research on the implications for women of color of having to work non-standard schedules and not having access to workplace flexibility, for example, by the Shift project. There's also ample research showing how beneficial remote and flexible work is for women, particularly women caregivers, but there's very little that directly addresses the situation of women of color. And so that's how we fit into the schedule. Now, before I hand over to Benderia, just very briefly, a summary so you can look, relax, and switch off for the next few more wordy slides. Pre-COVID, what we found was very unequal access to remote work, particularly by race and ethnicity and gender, but also a very strong correlation between remote work and exercising, especially for Black women. And exercising is our stand-in for healthy lifestyles. And then post-COVID, we found, as expected, increased and much more equal access to remote work, high levels of reported work-life balance, and strong positive correlations between remote and flexible work access and reported well-being and health. So now let me hand over to Benderia.
Thank you, Ariane. I don't see the slide yet.
Oh, I'm so sorry. Just having two screens is very, hang on, let me stop sharing. How do I stop sharing? That's yours, Benderia. Sorry about that. Okay.
Thank you. Thank you, Erin, for the introduction. Yeah, let me share our research on the pre-COVID results. We used the American Time Use Survey Leave and Job Flexibilities module from 2017 to 2018. Our sample includes employed women aged 15 and older, about 5,000 employed women. To measure workplace flexibility, we chose like 3 indicators. First is more of the employee-centered flexibility. So whether workers can have control over their location, remote work, or whether they can change start and end work time, which is we're referring to as flex time. The third flexibility is more from the employer point of view, so we can refer to as like a negative flexibility, right? Which is that women have non-standard schedules, so they work outside of 6 a.m. and 6 p.m. schedule, or they work on the weekend, or their schedule varies based on their job demands. In the American Time Use Survey, we use their exercise activities as a well-being measure. So exercise is defined as whether an individual participated in sports, exercise, or recreation on a given reference day. For a very brief outlook on the workplace flexibility, this is pre-COVID, right? We do see racial and ethnic unequal access to remote work and exposure to a non-standard schedule. So only 20%, less than 20% of Latinos and Black women have access to remote work compared to over 30% of Asian and white women, which are also similar to all men in the sample. And at the same time, 40% of Latinos and Black women have non-standard schedules, which is still far more than Asian and white women. In terms of flex time, the unequal access is less pronounced, but we still see that white women and all men have highest percentage to flex time. So when we talk about unequal access to workplace flexibility, a lot of people think that it's coming from education or the type of job they have or the earnings. Individuals like have, but if you when you like kind of disaggregate these groups into what type of job they have, we still see racial and ethnic differences. So in managerial and professional occupations, the gender gap even increases, and we still see that Black women and Latina women have less access to remote work compared to Asian and white women, and close to 60% of men in managerial positions have access to remote work. Similarly, when you look at caregivers, also men do have much higher access to remote work. And for Black and Latino women, have the least amount of caregivers, have the least access to remote work compared to Asian and white women. So next slide. So just switching our, like putting together this workplace flexibility and the exercising component and well-being. This is just to give an overlook of like what's the likelihood of exercise by gender, race, and ethnicity. We see that Black women, 12.4% of Black women participate in exercise on a reference day, which is the lowest. And Asian women and Hispanic women have close enough rates to white women, but we see that to start with overall sample, Black women have that lowest rate of exercise rate. And putting it together, right, we can see that the remote work access, so this graph shows that for each of these groups, when they have remote work, how much they exercise, and then when they don't have, compared to the counterparts in their groups, they don't have remote work options. So we see that Asian women and Black women have the highest beneficiary of having remote work options. For Asian women, they like triple the rate of exercise rate when they have remote work options. For Black women, they double the rate. And we still see increases for Hispanic and white women. And overall, even when you look at the flex time and the standard having less exposure to non-standard schedule, we see that Black women and Asian women benefit the highest consistently. And so this is our research for pre-COVID workplace flexibility and well-being. And now I'm going to turn it back to Ariane for our post-COVID results.
Thank you, Bendaria. So as she said, as Bendaria said, and there are lots more results in the report, so we urge you to look at it. But remote working can play a role in promoting healthy or enabling healthy lifestyles. Now, we try to update the results on access to flex time and remote work and health outcomes in 2024 with the survey of that we commissioned from Morning Consult. This is a national survey customized for working women ages 25 to 65. It does include self-employed women, unlike the American Time Use survey. And we did this because we know that self-employment often is a way to get more control over work schedules, or it can be at least. We use exactly the same questions on access to flexible work as in the 2018 survey, but focus more directly on perceived health and well-being as outcomes. So first, as expected, access to remote work is much more common, but also more equal than it was in 2018. Altogether, 4 in 10 women in the sample said that they can work remotely. It doesn't mean everybody does, but at least there's the possibility. And what we also found is that there was a big increase compared to 2018, particularly for Latinas and Black women, who in this sample are more than 40% saying that they have access. Less change for flex time. We grouped the sample into 2 large groups. One for those who have access to either or both remote and flex time. And then they are about 2/3 of the respondents. And then the other third are those who do not have access to either. So next slide. Okay, so what did we find? Firstly, flexible work options boosts worker satisfaction. Women with remote and/or flexible work options were significantly more likely to report satisfaction with their work-life balance. 71% of those with those options compared to just 48% of those without said they were very fairly satisfied with their work-life balance. Very high results overall, irrespective of flex time. Second, flexible work options benefit health. Women with remote and or flex work options were significantly more likely to report good or excellent health. 69% of those who have it compared to 60% who don't. And last, not least, flexible work options reduce stress at least a little bit. Women with access to remote and flexible work options were less likely to say that they were nervous, anxious, or worried every day or half of the time than other women. And 39% of those with flex options said that compared to 44% of those without. So we conducted this survey in November of last year, just after the election, but also at a time of high inflation. I guess a reminder that, you know, flex work options are not a panacea. And so in summary of this quick run through, access to remote work has become more equal and more common since COVID-19, at least for now. Remote and flexible work significantly increases the likelihood of exercising, especially for Black women, and remote and flexible work options significantly increase reported work-life balance and well-being. And with that, I hand back to Robyn.
Thank you, Ariane, and thank you, Vendaria. So now I have the pleasure of introducing my esteemed panelists. And thank you. I was going to ask you, Ariane, to. So first, I have Dr. Ebony Roberts. She is the Senior Director of Research for GirlTrek and leads the organization's research in Montgomery, Alabama, which is the demonstration site for a place-based strategy that is designed to extend life expectancy for Black women. She is also working to build a research clearinghouse to help advance GirlTrek's advocacy agenda. Ebony has a PhD in educational psychology from Michigan State University and has worked as a researcher for nearly 30 years. Next, we have Jasmin Bailey. She is the operations director at the American Association of People with Disabilities. In this role, she oversees the daily internal operations of the organization. And I must say that Jasmin is dedicated to the fight for equal rights for the disability community in the United States and abroad, and works every day to break down the attitudinal barriers that continue to hinder disabled people today. Jasmin has a bachelor's in exercise science and a minor in leadership studies from Mary Baldwin College, and she is also a graduate of the Virginia Women's Institute for Leadership. And last, but of course not least, we have Natalia Ramirez-Lee. She is the C. Keith Wingate Visiting Assistant Professor of Law at the Center for Racial and Economic Justice at the University of California College of Law, San Francisco. That's a mouthful. During her 2-year appointment, Natalia will contribute to the Center for Racial and Economic Justice work to advance equity and justice through legal education, research and scholarship, and academic community partnerships and collaborations. Natalia graduated from Berkeley Law, where she served as a managing editor of the Berkeley Journal of African American Law and Policy, and was awarded the American Jurisprudence Award in Constitutional Law. So thank you each for being here. And now I want to, start. My first question is going to be for you, Ebony. I don't know that everyone who's, all of our attendees are familiar with GirlTrek. So can you tell us about GirlTrek and its mission to unleash a mass movement for health justice? And then explain why the focus on Black women in particular.
Yes, absolutely. Well, first, let me say thank you for inviting GirlTrek and, being able to be on this panel, particularly because of the findings that remote and flexible work benefits Black women and their increased ability to exercise, which is so important for Black women. And I'll talk about that. So GirlTrek is the largest nonprofit in the US dedicated to improving Black women's health outcomes. Black women are dying at earlier rates than other groups of women. We're dying 5 years earlier than white women and 10 years earlier than Asian Pacific American women. And so GrowTrek's mission is to change that. We start by encouraging, inspiring, mobilizing women in their communities to walk. We walk for 30 minutes a day, 5 days a week. That is what the CDC tells us is the amount of time that that really could save our lives. It is the one thing that we can do. It doesn't require a gym membership. All we have to do is walk outside our door and walk for 30 minutes, 5 days a week, and we can reduce some of the chronic health conditions that are killing Black women, like diabetes and heart disease, by 50% by walking at those levels. And so our programming is designed, it's culturally relevant, it's designed for Black women, by Black women. And so it gets women out the door walking at levels that we have seen that, of course, women lose weight, but also they get off prescription medication. They're able to just really change their lives from the inside out. You know, there's obviously benefits, physical benefits, but there's mental health benefits to walking as well. And you all, you know, pointed that out with your survey in terms of the well-being of women who are able to work remotely. And so having access to exercise like walking, which doesn't require, as I said, any any gym membership or certain gear or anything to do. And so we focus on Black women because of those statistics. And as Black women, we realize that nobody's coming to save us but us. And so that is why we focus on Black women. We know what Black women need to get moving. A lot of the billion-dollar, weight loss companies, a lot of those things are really focused on aesthetics. And for us, it's not about aesthetics. This is about, our health. And we build community. And I think that is what makes GrowTrek different from other types of groups that are considered like walking groups or health groups, is that we build community, and it's much bigger than the individual. And so part of what we do, once women start walking and talking and working on their health, we actually mobilize them to become leaders in their community. Some of our members have gone so far as to push for policy changes or push for changes in walkability in terms of getting, safer streets to walk on. Some of our women are creating community gardens. And so it's much bigger than walking. It starts with walking, but once women are connected to other Black women, then the ideas begin to churn, being able to walk in your neighborhood and seeing the things that need to be changed in your neighborhood. One of our sayings is, when Black women walk, things change. We know that we have a history of when Black women walk, whether it's through the marches in Montgomery, if it's, through any of the boycotts. We know that when Black women mobilize and work together, that things change. And so that's what GrowTrek is about.
Thank you. I appreciate that. And I like that. I like the motto, when Black women walk, things change. I believe that. And I appreciate also, that you're sharing the benefits of exercise and mobility to Black women. But also, let's talk about the many reasons that make it harder for Black women to spend time on exercising. We know that there are family and community responsibilities. We know that there's oftentimes lack of resources. There may be some environmental barriers. But let's talk about the role of workplace and flexibility.
Yeah. Well, first I want to say that we talked to our members. We have been studying Black women, Black women's behavior. And of course, we have an understanding of the institutional racism that impacts Black women when it comes to work, when it comes to housing, when it comes to healthcare and access to healthy food, all the things that are social determinants of health for Black women. And so we have identified what we call the 3 deadly I's that are really the drivers of early death of Black women. One of them is inactivity, not getting, the exercise, but also isolation and injustice. We know environmental justice is one of those things. We know that, as I mentioned, institutional racism that impacts all of those social levers like housing and healthcare access. And with remote and flexible work, there's so many benefits to having a flexible schedule and being able to walk at any time of day, to be able to get that 30 minutes a day, because when you're sitting in front of a computer all day, whether you're in an office or you're at home, that sedentary, lifestyle is not good for us. And so being able to get out and get that 30 minutes in a day is really important. One of the things that I wanted to point out is that, while remote work is important and it provides that flexibility, we have discovered that isolation is one of those drivers. And so Black women are isolated, not just because some of us work from home, but just isolated because we may be the single parent household, isolated because we may be in environments that are unsafe and we don't feel like we can walk outside. And so there's many reasons why Black women feel isolated, and that's where Girl Trek comes in. And so if you are a woman who's working, who has the flexibility to work from home or has a schedule, you can connect with other women in your community so that you're not isolated, so that you can walk with other women, so that you do get your 30 minutes a day. Because some women don't want to walk alone. They feel for many reasons that, they don't want to walk alone. They need that accountability to get out the door. And so what we do is we have walking groups in cities and rural towns all over the country. We have Facebook groups. We have a website where women can connect with each other. And so being able to work from home gives you that flexibility to connect with women in your community. Rather it's, we have a group of women who, they have a crew in Jackson, Mississippi, and they walk at 4:30 a.m. single day. And they do that because they are determined to get their walk in, and they want to make sure that they get their walk in before their work day or, their day getting family, responsibilities. And so being able to have a crew gives you the accountability to be able to walk when it's convenient for other members in that community. So if it's 4:30 a.m. for some people, it could be 6:30 p.m. Or it could be noon. We actually have some of our programming where we actually do live, what we call walk and talks, where you can call in, listen to our co-founders, and walk with us virtually. So we make it possible for women to find many ways to connect, to encourage them to get that 30 minutes a day and 5 days a week. And of course, the flexible work options allow for more of that to happen, and so that women can start walking at those life-saving levels that will save their lives.
Thank you. I appreciate that. Thank you for that information. Excuse me, Ebony. And I have to say, as someone who loves to work out and exercise, 4:30 would be a reach. That would be a reach
For many of us.
but but the sentiment is there, and I think it's important. So I'm glad that you shared that. So I want to be mindful of time. I'm going to move over to Jasmin because I have a few questions for you. Thank you. So, Jasmin, as I had mentioned earlier, about this being the 5-year anniversary of the COVID-19 shutdown, specifically today, the 13th is the 5-year anniversary. This was the day that the White House issued the emergency declaration that started the move to remote working, to sheltering in place. And as I understand it, you were the person who had to make this happen for the American Association of People with Disabilities. So tell us about AAPD and what you learned from this experience.
Sure. Hi, everyone. This is Jasmin. And before I start, I just want to give like a brief visual description for any fellow blind folks or low vision folks that are in the audience. So I'm a Black woman, a medium brown complexion. I have my hair in a bun, and I'm wearing a beige sweater. And I'm the operations director at AAPD, and AAPD is a national cross-disability rights organization that fights for equal rights for people with disabilities. It's estimated that there are about 60 million people that live with a disability, so that's about 1 in 4 Americans. And we were established back in 1995, 5 years after the Americans with Disabilities Act was established. And that's the legislation that protects people with disabilities from discrimination from all aspects of society. Our organization has sort of 3 main focuses. The first is our programs where we focus to connect young folks with disabilities with employment opportunities. One of our popular programs is the summer internship program that has seen about 500 plus young folks with disabilities find employment through or employment opportunities through congressional offices, federal agencies, nonprofit and for-profit companies. So we also have policy focus where we work in collaboration with various companies and organizations to help with equal access for people with disabilities. And we also have initiatives like voting initiatives to help individuals, go and learn about different policies and learn how to be civically engaged. So those are just a few things that AEPD does. Um, so in my capacity as the operations director, I ensure that we have our um, our staff to work in an environment that obviously is suitable for them. During the 5 years or 5 years ago when we had the shelter in place order, we told our staff to move, to go home and to work from home. And it was, a little bit concerning at the time because we're a staff of all disabled women. And a lot of us have chronic illnesses. A lot of us have sensory disabilities, physical disabilities. So it was very worrisome to, be outside because we weren't sure, what sort of harm could happen to us specifically because of our disability. So the first thing that I did once we returned to work was to find out, okay, what does our team need? What can we implement to ensure that folks have the technology that they need to be successful? So we ensured that we had, laptops sent over. We ensured that we provided a stipend for folks to pay for their internet. So we really made sure that those sort of technology was in place. Then a couple of years after, once we were kind of returning back to work, we sent another survey to check, okay, what do you need to feel safe to come back to work? Will a hybrid approach be beneficial? Should we continue to work remotely? And based on the survey results, a lot of individuals cited that, a hybrid or a fully remote environment worked best for them and their disability. And there were just a lot of different sort of reasons on why. For an example, for me as a person who is blind, commuting back and forth to the office was very, in some cases, distressful because there are so many different microaggressions that disabled people have to deal with in terms of interacting with individuals on the street. Sometimes people who have very good intentions want to help, but sometimes they can cause a lot more harm than good. There are some instances where I have a colleague who has PTSD and developed PTSD and anxiety because of so many different ways that people have accidentally, hurt him by, falling down when they're trying to, give an arm to help cross the street. There's been cases where um, a, a a person trying to help accidentally knocked him in the train tracks of the metro station. So a lot of times, people with disabilities just face these sort of microaggressions on a daily basis. So uh, being able to work from home really alleviates some of those interactions. But I think probably one of the key takeaways from the pandemic is that, a lot of people with disabilities find remote work valuable because they have control over their environment. They are able to attend more appointments because people with disabilities typically have more health issues. So they're able to flex their time to make appointments. And a lot of times we found that actually more Black women and white women compared to Hispanic and Asian women typically have a disability. So it definitely helps those in those communities to, be able to handle all of the responsibilities that they have on top of, dealing with their disability.
Thank you. I appreciate that. And I'll take note from what you said earlier and mindful of those of us who may be listening and have a sight disability. I am an African-American woman with brown skin tone. I have nowadays Black hair with gray highlights. And I am wearing a multicolored shirt with white, mauve, and pink in it. So thank you for bringing that to my attention. I also want to thank you for bringing up the benefits that remote work has for individuals with disabilities. And so I want to take it to where we are today. From the studies and things that I've seen, the expansion of work options had a substantial impact on the employment of people with disabilities. Like you said, that they don't have to deal with some of the microaggressions and things that occurred when trying to travel from home to work. But now we're in vastly different times, including the president's callback of all federal workers to in-office work. So Jasmin, I want to ask you, what are you hearing from your members, and what are the effects specifically are you seeing that this trend is going beyond the federal government?
Yeah, so I want to start with a stat that I thought was pretty interesting from the U.S. Business Labor Statistics that looked at the employment rate of people with disabilities. So I looked at between 2015 and 2019, the employment rate of women with disabilities increased by 3 percentage points. And then when looking at 2020 to 2022, so between a 3-year span, it actually increased by 9 percentage points. So, and I would dare say that probably access to remote work was a probably contributing factor to that increase. And now with this sort of reversal of, making folks go back to the office, the return to office, I think a lot of disabled folks are worried. I think over the past few years, we have seen what workers with disabilities can do when they're in an environment that actually is conducive for them. For a lot of disabled people, as I mentioned before, it is not safe for some of us to go into the office, whether it's, because of fear of if interacting with other individuals, whether it's, if you have a allergy sensitivity, um, or you're allergic to fragrance. A lot of folks, prefer to just be in an environment that they can control and feel safe. So we have a lot of folks who are very concerned about the return to office move. I've actually received an email a couple of days ago. So AAPD has an information and referral service, although we don't provide direct legal advocacy for individuals. We do try to provide, resources to our partner organizations. And there's one case where there is a disabled veteran who has been working from home for about 10 years. He's been with the VA for 24 years. And now they're forcing the employees to return back to the office. And, he's very concerned because the in-person sort of aspect is not accessible to him. He has severe PTSD. And, this is something that's very harmful for him. And unfortunately, um, he was instructed to uh, follow up with a reasonable accommodation with the czar at his office. And unfortunately, they're not even responding to um, his inquiries. And he believes that, he is going to be let go because he can't even submit a reasonable accommodation to the Office of Personnel Management. So it's scary times right now, to be honest. So we're trying our best to, advocate for, policies to help support remote work, telework. We are trying to collect stories, work in partnership with other organizations to, really try to bring awareness because a lot of people think that work from home is more of a luxury sort of item to have as a worker, but really for a lot of disabled people, it's the only way that they'll be able to stay employed and to be able to maintain their independent living and to be, financially self-sufficient. So we have a lot of examples of, how this can be very dangerous and very harmful for, not only the disabled person, but, for their families, for their caregivers. So we're just going to continue to try to highlight those stories and try to, push the administration and also our partner companies to ensure that they are keeping inclusive practices within the workplace.
Thank you. Thank you, Jasmine. I appreciate it. And so now, Natalia, I have a couple of questions for you. Both Ebony and Jasmine have kind of highlighted some of the benefits of remote working we see for Black women, for the disabled community. But one of the striking findings from our current report on the intersection of work flexibility and exercise by gender, race, and ethnicity, and I believe Vandaria pointed this out, was that Black women had less access to remote work even when they worked in management and professional positions. And these are the positions that tend to have the highest access to remote work. So from your perspective as a legal scholar, what do you think is behind the difficulties that Black women often have in accessing remote work?
Yeah, that's a great question. So as you mentioned, there's deep-seated educational and occupational inequalities that lead women of color, including Black women, to be concentrated in jobs that just have less remote work options available. And so that is a big driving force behind the racial remote work gap. And really, occupational differences explain most of the disparity. But we did see a study coming out of the CDC from 2022 that controlled for occupational and educational differences, among other factors. And it found that even controlling for these differences, there was still a racial remote work gap. And in particular, the odds for Latina and Black workers to work remotely after controlling for these factors were 16% and 7% lower than for white workers, respectively. And the study pointed to the possibility of employers discriminating in remote work decisions. We know that remote workers of color are more closely monitored when they work remotely than their white counterparts. And this is because of enduring stereotypes that workers of color are lazier and less productive than their counterparts. And so these same stereotypes that can lead employers to monitor remote workers of color more closely can also lead them to deny them remote work opportunities. There's also the possibility that workers of color may be self-censoring and requesting remote work less frequently because they want to avoid these same kinds of stereotypes.
Oh, thank you. Thank you for highlighting that, because I think that's often missed and so forth. And it kind of leads into my next question, so as I mentioned before, during the last administration, access to remote work increased significantly, which is also a positive effect of diversity, equity, and inclusion, which these D&I efforts will help eliminate some of those things that you just brought up or decrease those. But now, of course, there's this big, retrenchment of both remote work and D&I. So what can you tell us about the benefits from remote work for Black women, as I know you have done research on this?
Yeah, so thank you so much. And yeah, with my research, I really wanted to understand how workers of color view and use remote work. And I think Ebony and Jasmin really highlighted some of these dimensions and educated me about some factors that I hadn't thought about. I think that from an intersectional lens, a disproportionate number of women of color are family caregivers because of an inability to afford care services on the market. And so for these women, remote work is a particularly valuable avenue towards workplace inclusion and workforce participation. We also see that remote work can counter the effects of residential segregation, and it can connect workers of color with a larger pool of employment opportunities, including higher paying opportunities. For workers of color who live far away from their employers, remote work can provide a means to engage in higher paying work while also avoiding some of the racial isolation that can accompany moving for a higher paying job. Often going to a higher paying job can mean moving yourself and your family to a place where you will be severely underrepresented and racially isolated. Remote work can also be a protective mechanism. As Jasmin pointed out, remote work can help avoid microaggressions both in your commute to work and also when you are in the workplace. And so it really provides a measure of psychological safety from stereotyping and from discrimination. We know that Black workers were much more reluctant to return to the office than white workers, and they rated their sense of belonging while working remotely twice as high as that of whites. In fact, they felt that their sense of belonging was greater when working remotely than when in the office. Beyond psychological safety, remote work can also provide physical safety. Women of all races and Black workers face a heightened risk of workplace violence, And that risk is largely tied to their concentration in jobs that require face time. And so avoiding face time can actually be a way to avoid workplace violence. And I found one case in my research where there was a woman requesting remote work because she was being subjected to racial threats in the workplace.
Gosh, wow. Thank you. So this then leads, and I'm mindful of time. I know we're approaching the end of this webinar, but I want to ask this to all the panelists at this point. From my conversation with all three of you, we know the benefits. We know the benefits to exercise and mobility. We know the benefits to various communities, those with disabilities, women of color. We know what it does to allow for those working remote to be able to take care of some of their caregiving needs and things of that nature. So if we know the benefits, then what can or should we do to make flexible work easier, especially for women of color? And I offer any of my panelists to kind of chime in to what they think what they'd like to say.
Kind of wanted to piggyback on something that Jasmin said, which is that sometimes people view remote work as a luxury. And I think that's really true. And we see this view really taken by employers, by our government, and even by our court systems and our judges, where they view remote work as what I call a rarefied perk. Some kind of fringe benefit that's reserved for a select few, generally higher positioned workers. But we know that our workplace norms radically changed during COVID. And now workers really view remote work as another dimension of their compensation or a really material benefit, kind of like a retirement account or health insurance. And so I think we really need to transform how we're viewing this issue and understand that remote work has really become a core part of the features of employment for many workers. And so we need to be really careful in decisions about remote work access.
And it's maybe an area where we can learn from other countries where a kind of negotiated access to alternative working patterns, remote work or flex time or changes in schedule, has been integrated more into employment law as a way of creating structured channels which workers can use to approach their supervisors or management, and to make management give reasons, denial if they can't do it for business reasons, but also explore the options that are there. And in the US, we have the caregiver discrimination protections in a couple of states and cities, which does what Natalie mentioned. You need remote work because you are a caregiver. Somebody else gets remote work because they want to train for a golf tournament, right? Which often happens. Or you get it because you injured your back and you're a man, but you don't get it because you need to look after your disabled child because you're a woman. So that is there, but I think we can do more in the statutory field to push this a little bit.
Jasmin or Ebony, I want to, and Beneria, I want to give you guys a chance to chime in as well.
I think the research that you all have done will go a long way in helping to push the conversation and to highlight some of the things that we've highlighted here. And Natalie's research is so fascinating. One of the things that at Girl Trek that we do is we model the mission. And I think, creating policies that allow women, whether they're working remote or if they're working hybrid, but allowing women to still be active. I want to just double down on the benefits and of walking and of exercise. And one of the things that we do that could be incorporated into some of the remote work policies is we have walking meetings, right? So we encourage our own staff to walk 30 minutes a day, 5 days a week. And so sometimes we actually schedule in a meeting and we're walking outside preferably, but sometimes, some people have walking pads or in, treadmills where they're actually walking so that they can continue to get the exercise, because we know sometimes we can't, physically leave home if we are working remote, but we still want to get our 30 minutes in. And we do that as well with our members, where we, as I said earlier, we create opportunities for women to connect with the movement during the workday and get their 30 minutes in, whether it's during their lunch hour, or we have podcasts that are available, walking podcasts that we have available that they can, listen to at any time. And so I think just encouraging women to take walking meetings, encouraging women to change the work culture where it's, understood and expected that, in fact, we have on our Slack channel where we can say, I'm taking a walk. Like, that's how important it is to us, and changing the work culture so that it is, it's a respected, break from the work day, just to take the 30 minutes. Cause that's not even, most people take a longer lunch hour. So, and it's not doing it on your lunch hour, but actually scheduling it into your day so that that time is sort of sacred and special for getting that time in, especially when you're working from home.
Yeah. Jasmin, yes.
Yeah, so I just wanted to add everything so far has been great. I think for AAPD, we make sure that we advertise on our job announcements that we have telework and flex work options. So just making sure that people are aware of that. We also made sure that we actually had to do a big office move during the pandemic, and we specifically chose a location that had a gym as part of the facility. So most of our staff actually are pretty active, physically active. So we knew that they were used to, trying to fit in, an exercise or workout after, work or during lunchtime. So we made sure that, when they do come into the office, that they can continue to have that option if they would want to work out. Also, sometimes during our staff meetings, we'll do, in lieu of an icebreaker question, we'll have time for people to do a little bit of chair aerobics or do a little bit stretching. So that was something that we wanted to make sure that we kind of encourage people to, take breaks here and there, and whether it's knocking out 10 push-ups or some squats at your desk, just kind of encouraging people to do so. And yeah, I think also, we text back and forth, just talk about, different workouts that we're doing, or, encouraging people like Ebony said, to just go for a walk and clear your mind. So we do try to integrate workout, a active sort of lifestyle throughout the day and outside of work.
Thank you. I know we're approaching time, and I wanted to, and I see that there was a question or two in the chat, and thankfully they'll be answered. I'll say this really quickly. One person asked a question about if the survey include questions about productivity measures, since there's an argument with employers who are trying to force or enforce office work policies and claim that productivity suffers. And I appreciate that Natalia answered that economists generally find that there are no productivity differences between hybrid workers and in-person workers. So I wanted to lift up that answer before we close out. We've approached 4 o'clock. And so I want to start by just closing out and thanking Ariane, Bendaria, Ebony, Jasmin, and Natalia for being part of this virtual event. I would be remiss if I didn't thank Robert Wood Johnson for his support of our research, and of course the audience for gracing us with your presence. And then lastly, I just want to remind all that both publications, Flexible Work and Women's Wellbeing, and the Intersection of Workplace Flexibility and Exercise by Gender, Race, and Ethnicity, are available on our IWPR website, and this webinar is available on IWPR's YouTube channel. So again, thank you, take care, and if possible, get out there and get moving, get exercising, and be healthy.
Thank you. Have a great day.
Have a great day, everyone.
Thank you.
Thank you.